Jazz? Okay. Okay, let's get started. Thank you everybody for coming here and welcome to Phoenix. Awesome to be among the sun with you all. So welcome to our session. It is called You Are Not Alone, How to Ask for Help as an Attending. My name is Megan Fix, and we are all from the University of Utah and BMC and UMass. And I'm gonna show you all of our amazing faculty in just a moment. But we really are here to help you. So here's our faculty. I'll let you all introduce yourselves briefly. We have Dr. Bollier.
Hey guys, Allie Bollier, one of the motion first review.
And then we have Dr. Middleman.
Hey, Andy Middleman from BMC, one of our APDs.
Dr. Kellner.
Rowan Kellner, I'm the Med Ed Fellow at the University of Utah.
Dr. Raps.
Christine Raps from the University of Utah. I'm one of the APDs and clerkship director.
Dr. Jandu.
Hi, my name is Samik Jandu. I'm one of the Med Ed Fellows at UMass.
Dr. Stroud.
I'm the person in the, dark ages in my photos. I'm the program director at Utah.
So thank you to Allie Bollier who submitted our session. This is really based to help you and especially focused on junior faculty, people who are coming out of residency, coming out of fellowship. Academic medicine can be very overwhelming, but it can also bring lots of joy and lots of collaboration and collegiality and all the things that we want in life. But that navigation can be tricky. So we have no disclosures, but we do have some objectives that we want to share with you today in order to help you have a very fulfilling, again, joyous career. We want to describe the stigma associated with asking for help at the attending level. We want to generate strategies to mitigate the pressure of academic overload, develop an approach to precepting learners while reconciling your clinical confidence, because we're all still learning, right? And we also want to identify how and when to ask for professional mental health care as an attending. So we have developed a case handout for you to use during this session. So if you will please go to this QR code. You can download this on your phone. This is the handout that we will be working off of for the cases today. So let me know if you have any issues with that. And I'm just going to describe how the session's going to work. So we have 15 minutes together today. We are going to go through 3 clinical and academic scenarios. And I'll explain. The first one's going to be academic overload. The second one is going to be clinical ambiguity. And the third one is going to be seeking mental health care. So we're going to describe these 3 scenarios with our expert presenters, and then we'll discuss each scenario for about 7 to 10 minutes. We're going to break up into 4 different areas. We're a little heavy on this side, so we may do some shuffling, but we'll have 4 groups. So 1 in the front, 1 in the back, 3 and 4, and then we will be rotating around. So once you get into your group, please stay in your group, and we will come to you and discuss. All right, everybody have the handout. Let's dive in then to case number 1, academic overload. Dr. Stroud and Dr. Raps.
All right, thanks for being here. So let's talk about academic overload. It is real and it happens to everyone. And it can be really challenging to navigate the stress that comes with your academic responsibilities and with the expectations of your new job. So let's imagine a situation where you've just completed your fellowship and accepted your dream university job. Your new leadership has just sent you multiple emails that detailing like everything that you need to do, your academic, clinical responsibilities, and also offered you multiple opportunities to get involved in teaching and research. You also have things left over from your fellowship. So you have 2 manuscripts left to finish and are moving across country for your new position. So we'd like to discuss some situations revolving this. And Dr. Stroud, would you like to join me?
I think you can all read, but these are the questions we're going to go over. So first of all, something I want you to think about is how should you evaluate these responsibilities and opportunities? And try to remember, those are 2 different words. How can you determine which opportunities are good for your academic retention and promotion versus just service work, which can also be good, but not the same thing? And what can you do to to protect yourself from academic burnout? So those are our questions. Separate yourselves out and provide us wisdom.
Sorry, we're going to make you guys move into 4 groups. And this is
All right, starting in the time. All right, everybody, stay in your groups. We're going to continue the discussion, but we're going to have a brief presentation on case 2. So stay in your groups and we'll come back.
in the interest of time management, got to keep going. So for case 2, we're going to address clinical ambiguity, because uncertainty is innate to EM, right? There's oftentimes many correct answers, and there's also lots of different practice styles. We each have our own unique knowledge and experience gaps, but working in and around things that we're uncomfortable with, well, that's part of our job. So I'm particularly excited about this case. We have designed a clinical scenario to challenge you with a device malfunction, but we want everyone in the room to get to feel uncomfortable. So it's actually a completely made up device. Simi, you want to tell us about our case?
So, you are a new attending. You're working with residents. It's a large academic medical center, and then a 57-year-old male pops on the board, chest pain, shortness of breath. You're like, I got this. It's easy. Chest pain, shortness of breath. It's fine. And then he says, oh, I have an LFAD. And you're like, LVAD? No, LFAD. And you're kind of looking around. You're like, what's an LFAD? But it's malfunctioning. You have no idea what to do. Also, LFAD is not a real device. So we're going to go over these few questions. You have no idea what it is. How honest should you be with your team members? You're a new attending. You have residents. You have nurses. You have techs. You have a patient in front of you and family. How do you navigate that? And then realistically, you're going to be calling a consultant about this LFAD device. What do you say to a consultant? Do you admit your knowledge gap? What do you do? And how does this change depending on your seniority? Say you just graduated residency and your first year faculty member or fellow versus your mid-career versus your 30 years into your career. Does this change? We're going to keep you guys all in the same groups, and you guys can discuss.
Okay, case 3.
Okay, hello. Yes, hello everybody. I'm Rowan. Okay. All right, so our third case is on seeking help, and more specifically, seeking help for mental health crises. So we have a case here, and I'm just going to read it out to you, and then we'll kind of go through some questions. So it's a standard day in a solo coverage, low resource ER. You got multiple critical patients. They come in all at once, and after securing the airway of one very ill patient, Tim is called to the CT scanner for a code stroke. Due to limited resources and untrained staff, the patient is not started on sedation. They self-extubate, suffer a respiratory arrest, and die despite Tim's best efforts. Tim feels responsible for the patient's death and has recurring thoughts about the case. Later that month, on his way to work, he feels lightheaded and his heart begins to race. He feels like he's dying and unable to work. He checks into the ER as a patient, but his workup is normal. In the coming weeks, Tim struggles to drive to work as he develops the sensation of dying while driving. These episodes worsen and begin to affect all facets of his life. So it's a strong case, but a true case. Here are some questions that we want to talk about sort of surrounding this case and sort of surrounding the issue of mental health in general, okay? So we don't have to read the questions. We all know how to go through them now.